it's roughly about 1 cm on this side, 1 cm on this side, and then they push the whole jaw in.
Okay, so I'm out again today because I'm going to see the dentist.
Hello?
It's Dr. Jeremy.
Do you want to rinse first? Maybe you can have a rinse first, yeah?
Sure. Yeah, so I just don't know if I have the option of doing Invisalign or should I just do braces.
Okay, alright. Now, let me just have a look. Can you bite down, please? Yeah, that's right. That's your normal natural bite, right? This side is not too bad. Alright.
So what happens if I were to go through with the jaw surgery?
1 cm on this side, 1 cm on this side, and then they push the whole jaw in. Okay?
How do they... Wait, they staple it back or do the...
Yes, they will staple it back. Yeah. I feel that if you actually do a jaw surgery and push this whole jaw in, you know, your whole face is going to change. You need to understand that you have a pretty sharp nose. Okay. So when you have a sharp nose, you do need a prominent chin.
To balance it out.
To balance it out. So can you imagine you have a sharp nose and then this whole thing... I'm not very sure whether you would be very happy
with the results
of the jaw surgery.
Okay.
Okay, we call it orthodontic surgery. Let's say, if you do not want to do a jaw surgery, so then we would need to just, instead of the skeletal portion, we are just doing the dental portion, that is only the teeth.
Okay, yeah.
Alright, now, of course, the bite would still be a class 3 bite. This is class 1, where the upper jaw is slightly outside, whereas the inner jaw is slightly inside. Okay, so this is actually class 1. Class 2 malocclusion means that the upper jaw is really protruding out.
Right.
Now in your case, yours is actually a class 3 malocclusion where the lower jaw is actually on the outside and the upper jaw is slightly inner.
Oh, okay.
Okay?
Oh,
slightly.
Really? Okay.
Yes, very slight.
But also, am I right to say that your teeth, right, in order to look nice, like aesthetically, like the upper jaw should be actually pretty
slightly out. Slightly out. It's just slightly.
Okay, but should I do Invisalign or should I do
both are equally
like with my teeth like this, if this one like sticking out?
Yeah, that's not an issue.
Oh, okay, because the last time I went, I remember very clearly the other orthodontist told me that Invisalign wouldn't be that good an option.
It could be quite some time ago because the technology has basically improved a lot.
Okay.
Okay. I can actually show you, my next patient.
So Dr. Jeremy is going to ask the other patient that he has in the other room now if he is okay to show me how he looks like with his Invisalign situation, and I'm just gonna consider. I just don't know if I'll be comfortable having this on my... So yeah, this decision to do braces has been bothering me for a few years now, and I'm thinking now like I should just try it out.
This was his tooth initially. Okay.
Oh, okay.
Alright, and there are some teeth that we have already extracted.
Okay.
Okay, we are not done yet with him.
Right.
But at least at this point of time, okay, if you can just remove a quick and smile. Okay.
Oh, nice.
Okay, at least it's quite aligned in that sense without
so you had your front tooth stuff taken out. Okay.
Yes.
Right. Okay.
So
cool.
this is one case.
Right.
Alright.
Okay.
Thank you.
Thank you. So for Invisalign, do I have to wear it like 24/7?
I would suggest you wear it at least minimum 20 hours per day.
Oh, okay. Right, it's okay, I have very strong determination.
20 hours per day means that 4 hours is actually for you to eat.
Oh, okay.
Right?
So when I eat, I can take it out?
Yes, you have to take it out when you eat.
I was mentally preparing myself that I will not be able to eat nuts for like the next 4 years.
Oh, why?
No, because I thought I was gonna be able to only do braces because it gets stuck in between and stuff, right? Very difficult to clean. Yeah.
I would say that the standard metal braces, number one, is a little bit more lasting because the ceramic sometimes tends to fracture or crack if people like to eat nuts and all this.
Right, it's a bit more brittle, right?
And number two, because the metal actually is stronger, you would actually have a better finishing.
Okay.
Comparatively with the ceramic braces.
Right, which is nicer also because it's
that's right. You want a good you want a good finishing, and of course in terms of cost it's also cheaper. The other thing about ceramic braces is if you look at the advertisement, it looks good, right? Because wow, it's all white and it looks like your own teeth and all these sort of things.
But it gets stained.
That's right. So if you don't brush it properly, you know the margin of the studs actually gets stains, and it will look worse than the metal.
Especially for coffee drinkers.
In a sense, yes.
I mean, black coffee is already dark. Right? So my next question is, like with my teeth situation, how long do you think I need to wear Invisalign for?
Invisalign, okay, so in your situation, likely you may need about 50 trays, 50 sets of this.
Okay.
Now each set you're supposed to wear it for 2 weeks.
Okay.
Alright, so 50 sets means about 25 months, which is actually 2 years, which is roughly about the same as a normal standard braces.
It's very hard to
imagine that a piece of plastic will
be able to pull like this teeth that's here, like down.
It's the same as this. We actually pull everything down, and if you can see when he starts with, see all this, right? Yeah, it's all over the place.
Right.
Right, and then you see over time, you can actually pull it everything.
And then so when you're wearing Invisalign, right, is there like this pulling sensation or?
Definitely.
Okay.
There will be sensation for the first 1 or 2 days when you wear a new set.
Like there will be some form of discomfort lah, but then it should be fine after a while.
That's right. It should be fine after a while.
Okay. Cool.
Okay.
Yeah. So the appointment with Dr. Jeremy is done. Now I have to decide if I want to do Invisalign or go with the braces approach. And I think I'm going to go with Invisalign because I think this is the only approach that won't change the aesthetic of my face that much, or like how I appear to be. And having no ulcers from the braces is a really plus point. I'm just going to take a day or two to decide, so we'll see.